Hi everyone, this is Dr. Hamrah. Today we're going to talk about the difference between Botox and fillers. The reason why I made this video is every day I get the question about, Doc, what's the difference? Do I need Botox or do I need fillers? It's very simple. So Botox is a neuromodulator, meaning it paralyzes your muscle. So when you have wrinkles that you get when you smile, called laugh lines around the eyes, or frown lines, the 11s. I can't really frown right now because I have Botox myself, so I can't show it really, but you would get these 11s here. Or when you raise your eyebrows, which I can't really do either, but if I did, I would get these long lines, and I'll show you what that means and how it looks like. It kind of looks like this. So when you see those lines, sometimes they can become permanent, particularly when you do it every day. So over the years, those lines that you create when you raise your eyebrows, frown, or laugh, they will become permanent. Kind of like your leather couch. First day it looks good. 6 months later, you might see a little wrinkle here and there, and 10 years later, you really can't do much about it, and you're going to think about buying a new leather couch. It doesn't matter how often you treat it, how often you condition it. It's called wear and tear. Same goes with our skin. So our face undergoes wear and tear. Now, it undergoes wear and tear more quickly if you abuse your skin. How can you abuse your skin? Sunlight, sun damage, stress, nutrition, cigarette smoking, a lot of environmental issues, they affect your aging of your skin. So one way is to prevent those things, and another thing is to protect your skin through Botox, meaning injecting an agent that prevents you from creating those wrinkles. Now some of you might think, well, wait a second, I don't want to look plastic, I don't want to look fake, I don't want to look weird. I get that. I don't want you to look fake and weird either. All we're doing is we're weakening the muscles. So this can be really gauged according to how much filler or Botox we inject. In case of Botox, all we have to do is lower the dose. You can still move it a little bit, not to the extent where you can create those deep lines and wrinkles. And I always discuss it with you when you come here for the consultation. I'm going to give you a mirror, we're going to look together at your face, and we're going to decide what is it that you want. It's very simple. The good news is, if for whatever reason you don't like it, you know the effect only lasts about 3 to 4 months. And after 3 to 4 months, we usually what we call fine-tuning. We're going to discuss the results, and depending on what your needs are and what you like, we're going to modify that. So that's Botox. As far as fine lines or deep lines or wrinkles or folds like around your mouth called the nasolabial folds, or the marionette lines in the corner of your mouth, or simply lack of volume. All of us, as we age, we're going to lose volume in the face. Usually it starts with the mid-face, the cheekbone area, and around the nose, and sometimes around the temples. So how are we going to address those? Well, that's where fillers come into play. Fillers, they are agents made out of a certain gel with different ingredients. I'll get into that in more detail, but just so you grasp the concept. Imagine you've lost volume and you're just replenishing the volume. So we're not overdoing it, because a lot of patients have the concern, well, Doc, I don't want to look unnatural, I don't want to look like a blowfish. Guess what? I don't want you to look like that either. So all we're doing is we're turning back the clock. So we're injecting stuff under your skin, under your muscle. As a matter of fact, sometimes even over the bone. So it's in a very deep layer to increase the volume, to give you back the three-dimensional plasticity of your face that creates the light reflections and the shadows. Remember, to the ladies, whenever you put makeup on, what do you really do with the shadows and the rouge that you put on. All you're doing is you're recreating or giving the illusion of shadows and light reflection. What that does, it gives a more plasticity and a more three-dimensional illusion of your entire facial contours. Well, guess what? If you recreate that, you have to use less makeup, and you let the light create the reflections and the shadows. So there's different fillers, and I'll take my favorite one here for the volume replenishment, or the nasolabial folds, or the marionette lines. So this is Radiesse. It's made out of little beads that have hydroxyapatite. Now, what the hell is hydroxyapatite? Hydroxyapatite is a molecule that is common in our bones. It's a hard substance that makes the hard part of the bone. Now, don't worry, we're not injecting bone in you. These are tiny beads that are encapsulated in a gel bead to make it injectable. So it's a molecule that's naturally occurring in your own body. That's why your body really doesn't recognize it as a foreign object. As a matter of fact, it will resorb after 18 to 24 months. Sometimes longer, sometimes sooner. It really depends on the patient. There is differences also depending on the volume they inject, depending on what you're trying to achieve. So to give you an example, let's say you just come in, you just have these nasolabial folds, and your volume in your midface is perfectly fine. All we need to do is inject a little bit in your nasolabial folds. Usually a syringe will do the trick. If you want to know what a syringe is, it's really 1 cc. Now, if you don't really know how much is 1 cc, it's really, to imagine, if I give you an analogy, if you take a ketchup pack, one of the small ketchup packs, a ketchup pack is about equivalent to about 3 syringes, 3 to 4 syringes. That's how much a ketchup pack is. So it's not much. Imagine we're going to fill in your whole midface, your nasolabial folds, and your marionette line. Typically, patients for that type, they need about 4 syringes. But again, depends on what you're trying to achieve. So what happens if we inject fillers in the nasolabial fold over time? A lot of these fillers, they actually promote collagen synthesis. So your body trying to encapsulate these beads creates collagen. Our skin is made out of collagen, which is a great side effect because not only you will get the filler effect through the filler itself, but also through your body creating collagen. So it's a double whammy effect, which works great. That's why I usually tell patients, wait about 2 to 4 months to see the final results, because it takes about 2 to 4 months for your body to create the collagen so that you can see the effect of it. So as time goes by, you actually will look better. The good news is, the same day of the injection, you actually already see the result just by the sheer volume effect of the injection. So the filler is for lines and folds and wrinkles that are present when you're not animating, when you're not frowning, when you're not laughing. Okay? So that's the difference. It doesn't paralyze the muscle, but it just fills your skin in. There are other fillers like Juvederm Volbella. Now the XC means that it has lidocaine in it. Lidocaine, all of you know from going to the dentist, numbs the tissues up. So as I inject this, it numbs up the tissue so you don't feel pain. The first injection you feel a little pinprick, but after that it just numbs it up. In the past we used to give all kinds of facial local anesthetic injections, but now we don't need to. So the Volbella is good for the lips because it's made out of hyaluronic acid. Hyaluronic acid is what we have in our joints, in the fluids around the joints and the cartilages. So it's also a natural occurring molecule, therefore our body really doesn't recognize it as a foreign object. You know, all these things are made in the laboratory, kind of like drugs like insulin and other drugs are made. In the past they used to come from animals, even fillers. We used to get it from cow collagen. It was a huge hassle because some patients used to be allergic to it, and we had to check it first 24 hours prior, and it was just a huge hassle and ordeal. Today, we don't have to worry about all of that. So a lot of patients ask me, well, what if my body rejects it? Your body can't really reject something that it has inside. So it's just so rare. As a matter of fact, about 10 years ago, I wrote a chapter on facial injectables, and it was amazing. About 10 years ago, all of these new products were coming out, and every week there was something new. But in the past 10 years, it's kind of been steady. There's just been modifications of the already present fillers, and so it has a great track record. And while I was doing the research in that field, I noticed the most complications are extremely rare. Mostly it's due to lack of cleaning prior or during the injection. So we make sure we really clean up the area really well so there's no bacteria that get transferred into the face. And a lot of the other complications are usually and mostly due to inexperience injecting in the wrong layer of the skin, and that could in turn cause problems. None of which are dramatic at the end of the world. They can all be treated, but you have to make sure you are with an experienced injector that knows what they're doing and that they also can handle these minor complications. Other fillers like Juvederm Ultra XC, this is a little thicker substance. It's really good for the lips, to filling the lips, but also for the nasolabial folds. This usually lasts about 9 to 12 months. And there is another one called Juvederm Voluma, which is very similar to the Radiesse that I talked to you about. I love to use this, especially in the mid-face, to increase the volume as well as the nasolabial folds. The advantage of hyaluronic acids with Juvederm is a hyaluronic acid. Compared to Radiesse, the one that I showed you before, which is the hydroxyapatite, is that with the hyaluronic acids like Juvederm, you can correct things. Let's say you don't like the result, there is actually an enzyme you can inject where you injected the filler that just dissolves the product. I think I only had to do it once in the past 20 years, and it was a patient that came from elsewhere and didn't like the result and asked me if I can correct it. Once I knew they used hyaluronic acid, I could fix that for it. So Radiesse is probably more for the experienced injector, just because you can't afford any mistakes. But it's a great product. Again, it's one of my favorite. And then other fillers, they're even thinner than the Juvederm, is the Belotero. This is a perfect product, perfect filler. Also hyaluronic acid, like the Juvederm, but it is much less viscous, and it works great for underneath the eyes, for the troughs underneath the eye, for the dark circles and the hollowness in the eye. You inject it right under the skin. The skin under the eye is the thinnest skin in our body, so you have to be very precise, but it works very great because it doesn't create the tindling effect, meaning it doesn't give you the bluish hue, and it doesn't absorb a lot of water like the other hyaluronic acids do, where you get this swelling look, almost like it looks like you have real bad allergies. That's why before Belotero I didn't like to inject under the eyes, because people attract the water around the filler differently, and you couldn't really gauge the result. And which is the strength of these fillers. What makes them so great is because we can anticipate the outcome, as opposed to some people inject fat. You can't really anticipate the result with fat because a large percentage of the fat actually resorbs. So because of that, you really don't know how much fat do I inject. So for that reason, it's more unpredictable. So these fillers are very predictable in the right hands, of course. So I hope this gave you a little overview about what fillers are, and stay tuned, and I'll show you right now some pictures of before and afters. Thank you so much.